नमस्कार, मेरा नाम डॉक्टर जोशिता पंडिता है और मैं यहाँ फोर्टिस हॉस्पिटल मेडिकल सर्विसेज टीम से डिप्टी मैनेजर हूँ। आज हमारे साथ डॉक्टर सोनल गुप्ता ने ज्वाइन किया है। थैंक यू मैम फॉर कमिंग। So Dr. Sonal Kumta is our senior consultant and a full-timer in OBGY department, and she has been working for last 20 years in Fortis Hospital. So ma'am, welcome here, and now you have come. So let's discuss and clear some of the doubts that we have regarding the conceiving. So first thing first, coming here. So is it impossible to get pregnant during the first time when you have unprotected sex?
Okay. No, it's not impossible, but it's usually it only happens in movies.
Okay.
That people would have
Right.
intercourse, unprotected intercourse once, and you get pregnant. It may take a while,
Right.
and especially for our younger couples these days, or so to say, the stat generation,
Right.
they press buttons and they want
Yeah.
things to happen. So it's very important to tell them that averagely a couple who's having regular intercourse may take even 10 months to a year to get pregnant. So that is the kind of time they should plan ahead, because otherwise they start trying for pregnancy and they don't get success, and in the first month they get very disappointed.
Understood.
So yes, it can happen, but it's not going to be a
Mostly it
regular
takes
thing.
time.
It will take some time. Yes.
Okay. So ma'am, is it possible to get pregnant at any time of the month for a female?
No, to explain this question better, I think I'll just quickly tell you about the ovulation cycle.
Right.
So the day a woman starts bleeding, let's call it the day one
Day
of
one.
her menses. Now usually one of the ovaries will produce an egg in that cycle.
Right.
So this egg starts to develop on the 7th day, and it will increase and become a mature egg that is having a power to get pregnant by about day 14 or 15. So that is the time where one should try and have intercourse if they want to get pregnant, and they should avoid that time obviously if they do not want to conceive, and of course they will use contraceptives to avoid pregnancies also.
Great. So ma'am, can the couple get pregnant during the first 2 days of the month of the cycle?
So if you are calling the first 2 days as day 1 and day 2, no, definitely very unlikely that they would get pregnant then.
Okay.
But if they are looking at a 2 days window, because a lot of my patients, they often come and tell me that, doctor, I cannot tell you this, but I feel extremely ashamed but embarrassed, because they tell me we are so damn tired by the time we come back home that it's very difficult for us. So can you tell us 2 days when we can have planned intercourse, so we can maximize our chances of pregnancy. So if we are looking at those 2 days, then I would like them to take a holiday or take off at the time when we are expecting ovulation, which would actually be in the middle of the cycle.
Okay. So as we are discussing pregnancy, so during the period time, so if the person does the intercourse, so is there any chance of getting pregnancy?
So the chance of getting pregnant while you are menstruating or having active menses is very, very low, rather negligible.
Okay.
But for someone who is going to use this as a contraceptive, they under no circumstance want to get pregnant.
Right.
I would ask them to have safe sex practices throughout the month.
Right.
And they should not take such a chance.
Right.
But for someone who wants to get pregnant, having sex during the first 2 days of your periods is not going to help really.
Not gonna. Okay. So ma'am, now menstrual cycles, are they always 28 days and the ovulation starts only at 14th?
Definitely not. We are not computers,
Yeah.
like a lot of people would think. So each individual will have their reproductive cycle, will have their reproductive axis. Averagely, a woman should get her periods somewhere between 25 to 35 days.
Right.
And the most common period cycle is 28 to 30 days, and that's why a lot of patients think, oh, I get periods after 26 days, so is there a problem with me, or I'm getting my periods 2 days late. The way they talk
Right.
also, they don't say I don't I get a 32-day cycle. They say I get 2 days late.
Yeah.
Well, you're not late. As long as you're getting your period somewhere between 25 to 35 days, that's perfectly fine. But we will have to then calculate your ovulation day accordingly. And typically it will be, what is your cycle duration? Let's say it's 30 days. You minus 14 days from that.
Understood.
So 15th or 16th day would be the day of ovulation.
So in a nutshell, every body is different, every person's cycle is different. You need not to worry until and unless it's 25 to 30.
So we do at Fortis Hospital where I work, we do specifically do something what is called as preconception counseling. I also encourage my patients to come for premarital counseling, and in both these counseling sessions we like to involve both the partners, and we preferably like to keep the rest of the family outside. And we talk to them about all these things, you know, all these myths that they have, all those things that they are thinking or they've read about somewhere or they've heard from their friends, and we like to clarify all this and give them a good insight and help them. If their decision is to plan a pregnancy, we help them plan one. If their decision is to avoid a pregnancy for a time being, then we help them with those two. So
Thank you so much for the insights, ma'am.
Thank you.
And I would request our viewers, in case they have any other further questions, please put in the comments. We'll try to answer them. Thank you so much.